H3N2 virus influenza. H3N2 is a subtype of the influenza A virus that can cause seasonal flu in humans. It is also known as the Hong Kong flu, as it was first identified in Hong Kong in 1968. H3N2 influenza viruses undergo frequent genetic mutations, making it difficult to develop long-lasting vaccines. Each year, the World Health Organization, WHO, recommends new strains of the virus to be included in the seasonal flu vaccine, based on global surveillance of influenza activity. Symptoms of H3N2 flu are similar to other types of flu, including fever, cough, sore throat, body aches, and fatigue. Complications can include pneumonia and worsening of underlying medical conditions such as asthma or diabetes. Prevention measures include getting an annual flu vaccine, washing hands frequently, avoiding close contact with sick people, covering coughs and sneezes, and staying home when feeling sick. Treatment options include antiviral medications, which work best when taken within the first 2 days of symptoms. How dangerous is H3N2 flu? H3N2 flu can be dangerous, especially for certain high-risk groups such as the elderly, young children, pregnant women, and people with underlying medical conditions like asthma, diabetes, or heart disease. The severity of illness can vary widely, from mild symptoms to severe complications that can result in hospitalization or even death. In the United States, H3N2 flu has been associated with more severe seasons of the flu, compared to other subtypes. This is because the virus can mutate rapidly and become less responsive to current vaccines and antiviral medications. However, the severity of H3N2 flu can also depend on other factors such as the overall health of the individual, the availability and effectiveness of medical treatments, and the strain of the virus circulating in a given year. It is important to take preventative measures, such as getting vaccinated, washing hands frequently, and avoiding close contact with sick people, to reduce the risk of getting H3N2 flu or spreading it to others. If you experience flu-like symptoms, it is important to seek medical attention promptly to receive appropriate treatment and prevent complications. What type of flu is H3N2? H3N2 is a subtype of the influenza A virus. Influenza viruses are classified into 3 types: A, B, and C. Influenza A viruses are further divided into subtypes based on 2 proteins found on the surface of the virus: hemagglutinin, H, and neuraminidase, N. H3N2 is named after the types of H and N proteins it possesses. The H protein allows the virus to attach to host cells, while the N protein helps the virus spread from one cell to another. There are multiple strains of H3N2 influenza viruses, and they can undergo frequent genetic mutations, making it difficult to develop long-lasting vaccines. H3N2 influenza viruses can cause seasonal flu in humans and have been responsible for numerous flu outbreaks and pandemics in the past, including the 1968 Hong Kong flu pandemic and the 2017-2018 flu season in the United States. How infectious is H3N2? H3N2 influenza virus is highly infectious and can spread easily from person to person through droplets in the air when an infected person coughs, sneezes, or talks. The virus can also spread through contact with contaminated surfaces, such as doorknobs or utensils. The incubation period for H3N2 flu is typically 1 to 4 days, and infected individuals can be contagious starting from 1 day before symptoms develop to up to 7 days after becoming sick. In some cases, infected individuals may not show symptoms but can still spread the virus to others. The infectiousness of H3N2 can also vary depending on the strain of the virus and the individual's immune system response. Some strains may be more contagious than others, and individuals with weakened immune systems may be more susceptible to infection and more likely to spread the virus to others. To prevent the spread of H3N2 influenza virus, it is important to practice good hygiene, such as washing hands frequently, covering coughs and sneezes, avoiding close contact with sick people, and staying home when feeling sick. Vaccination is also an effective way to reduce the spread of influenza viruses, including H3N2. H3N2 flu symptoms. H3N2 flu symptoms are similar to other types of flu and can range from mild to severe. Some common symptoms of H3N2 flu include fever or chills, cough, sore throat, runny or stuffy nose, headaches, body aches or muscle pain, fatigue or weakness. In some cases, individuals may also experience gastrointestinal symptoms such as nausea, vomiting, and diarrhea, although these symptoms are more common in children than in adults. Complications of H3N2 flu can include pneumonia, bronchitis, sinus infections, and worsening of underlying medical conditions such as asthma or diabetes. Severe complications can lead to hospitalization or even death, especially in high-risk groups such as the elderly, young children, pregnant women, and individuals with weakened immune systems. If you experience flu-like symptoms, it is important to seek medical attention promptly, especially if you are in a high-risk group or if your symptoms are severe or persistent. Early treatment with antiviral medications can help reduce the severity and duration of illness and prevent complications. H3N2 flu treatment. The treatment for H3N2 flu typically involves managing symptoms and preventing complications. This may include antiviral medications. Antiviral drugs can help reduce the severity and duration of H3N2 flu symptoms and prevent complications. These medications work best when taken within the first 2 days of symptoms. The most commonly used antiviral drugs for influenza include oseltamivir, Tamiflu, zanamivir, Relenza, and peramivir, Rapivab. Antiviral medications are usually prescribed by a healthcare provider and should be taken as directed. Over-the-counter medications. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help reduce fever and relieve muscle aches and other symptoms. Fluids and rest. Getting plenty of rest and staying hydrated can help the body fight off the infection and prevent complications. Oxygen therapy. In severe cases, oxygen therapy may be needed to help improve breathing and oxygen levels. Hospitalization. Hospitalization may be necessary for individuals who are at high risk of developing complications, such as the elderly or individuals with underlying medical conditions.